So my journey of patient advocacy actually started with my own personal experience. I had a heart attack at 33 about 5 years back. And when that happened, it threw a lot many challenges which were not known to me earlier. And right from what do we do about preventive care, or how do we manage treatment protocols better, or maybe what happens post discharge, how do we ensure medication adherence, or getting patients the mental health support or the health literacy that they need. So all these aspects which I have realized firsthand when I had a heart attack led me to the discovery of these aspects of healthcare ecosystem. And that's when I decided that the pain that I and my family had endured, no other person should bear that pain. And we converted that pain into a purpose so that our messages can reach out to more and more people, and we can make sure that such incidences can be prevented. And we also kind of wanted to strengthen the healthcare ecosystem so that such events which people face, specifically in cardiovascular disease, they can be prevented from them and they can manage their condition better, and overall the healthcare ecosystem improves. So the three main areas of focus at Heart Health India Foundation is first one is prevention and early detection. So we focus a lot on creating awareness programs, educational material, various on-ground activation, digital programs, etc., so that more and more people can know what kind of risk factors are there specifically for cardiovascular diseases, and what is it that we need to do. So, call to action for getting your testing done, your screening done, checking the symptoms. So, we do it through multiple platforms using social media, using print media, using digital media, so that more and more people can actually know about it and they can take an action before it's too late. Second thing that we do is related to peer support system. So community-led model wherein we kind of run communities of patients where patients support each other and their journey is curated by healthcare experts. So in these forums, we have patients talking to each other, sharing their concerns, their questions, their learning gaps, their knowledge gaps, their emotional needs, etc. And then we have healthcare experts, which include cardiologists, which include psychologists, which includes physiotherapists, nutritionists, fitness experts, and many other experts who kind of help these patients learn of what they could do to help improve their condition. At the same time, the ecosystem also helps do a two-way learning process where our practitioners also get to know the perspectives or insights from patients, which helps them get into a listening mode, that what is happening outside clinics, what are the concerns which people have outside clinical settings, and how their lived experience can be used to improve healthcare ecosystem. So that's number two. And number three is policy shaping and research and advocacy, in which we leverage the insights that we generate from patient communities, from people who are at risk. And these insights then we convert into policy dialogues and into various knowledge materials, various research papers, and using these insights to inform healthcare ecosystem stakeholders that how they can improve these healthcare ecosystem by leveraging these insights, which are not strictly clinical but outside clinical setting, in real life, in real world, what kind of experiences people are having and how these experiences can shape policy making. Patient experiences actually range from all the entire continuum of care, right from prevention to emergency management to post discharge care. And in each of these stages, patient care pathways can be structured with the help of patient experts. And in each, we find insights. So, for example, why people are not getting screened, or if they are getting screened, why not they taking action and going and meeting their uh, doctors to check what they need to do. And when patient experts work with the healthcare ecosystem stakeholders, they help resolve issues like this. So, right from prevention to actually designing treatment and discharge protocols. So, when patients are there in hospitals or their families are there in hospitals, what they need to know, how you calm them down, how do you reduce their panic level, make them be more of themselves, help them understand what they are going through, and then bring more satisfaction to patient stakeholders. So all these are really good avenues for them to participate. At the same time, when it comes to post discharge, so there are missing links, for example, cardiac rehabilitation. So how do you make sure that patients know what are their rights, what kind of procedures they need after they have come out of a hospital setting? As a team approach, when healthcare ecosystem stakeholders have to work together, so how patients can navigate their teamwork and become part of the patient care team. So many of these things are actually presenting newer opportunities for patients to become part of shared decision making models, and not just going top down and patient as passive recipient of the care, but also patient as active co-creator of the care, and sharing these insights to make the healthcare ecosystem better. This is a very important area. What happens most of the time when we think of patient care, we think of top-driven, clinician-led model, wherein clinicians provide their expertise in helping patients get better and achieve better outcomes. But we have seen in many cases there are systemic issues because of which the care is not received as it was supposed to be given. The adherence issues are there, whether it is related to treatment or whether it is related to regular medication and so on, and getting tested and repeatedly meeting and follow up with your doctors. And why this is missing becomes actually out of control for many stakeholders. People want adherence to happen, but it's not happening. And that's where shared decision making actually plays a big role. So patients are not just human bodies that need a medicine or a treatment, but they are more than a body. They are human beings, and they respond to real human experiences. So if we start thinking of them as a real person who have needs beyond clinical treatment protocols, who would like to understand what they are going through, what are their preferences, what is it that works for them, what is it which doesn't work for them. So a lot of these things which we often tend to miss, these things can be actually co-created with the help of shared decision making. And obviously clinicians play a big role and a very major role in improving outcomes for the patient. But at the same time, if we start looking at patient as co-creator, then the outcomes will be better, then the protocols will be better, and the adherence will be better. So that's the reason why we feel that we need to start working on shared decision making models so that patient outcomes can be improved further.